Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. November is National Diabetes Awareness Month, a great opportunity for some reminders about this chronic and potentially serious illness. Joining us to talk more about it and about IDPH efforts to help those with the disease is Keturah Tracy. She's the Diabetes Program Manager for IDPH. Keturah, thank you so much for being here. I want to start with sort of the big picture overview. What is diabetes, and specifically two different types of the illness? So how do we distinguish between type 1 and type 2?
Well, thank you so much for having me. I guess first I'd like to explain that glucose, or blood sugar, comes from the food we eat, and our bodies use it for energy. In people who don't have diabetes, the body produces a hormone called insulin to help glucose get into the body's cells so they can work properly. Generally speaking, diabetes is when blood sugar is above normal because the body either doesn't produce enough insulin or it can't use its insulin as well as it should. So with type 1 diabetes, the body either doesn't make insulin at all or makes very little of it. With type 2 diabetes, the body makes insulin, but the body's cells can't use it properly. And then there is also gestational diabetes, which is not as common at all, and it only occurs during pregnancy. But it can increase the risk of type 2 diabetes later in life for both the birth parent and the child.
I want to talk a little bit more about each of those, but again, is sort of sticking with the theme of an overview here. How many people in Illinois and around the country are impacted overall by diabetes, and can we break it down by type in that regard?
Certainly. So in public health, it's generally more common to talk about rates of diabetes generally rather than by a specific type, but we do have some older data on the breakdown. According to CDC in 2016, roughly 1/2% of the U.S. population had type 1 diabetes. Of all diabetes diagnoses, about 6% are type 1, 90% are type 2, and then the remaining 4% are other types such as gestational diabetes. And the statistics for Illinois are comparable to the nationwide statistics. Also, in terms of financial impact, according to the American Diabetes Association in 2022, the average medical expenses among people with diagnosed diabetes were 2.6 times higher than the general population.
And obviously with those numbers, we'll focus a lot of our attention here on type 2 diabetes, but because there are a number of people here in our state and around the country that do deal with type 1, let's talk a little bit about that. And I've seen this referred to as an autoimmune disorder. Is type 1 diabetes preventable, and is it treatable?
So type 1 diabetes used to be called juvenile diabetes because it often occurred in children, but according to Breakthrough T1D, which is a national organization with an Illinois chapter that specializes in type 1 diabetes and its research. At this point, over half of new type 1 diabetes diagnoses are in people aged 20 and older, so it's no longer called juvenile diabetes. Also, around 85% of type 1 diagnoses are in people with without a known family history of the condition. So to answer your question, no, we don't know how to cure it. We don't quite understand how it happens, but it is considered an autoimmune disorder. Research continues both to try to discover alternative treatments and to prevent the condition in the first place. But for now, the treatment is injectable insulin to provide the body with what it needs to process glucose for energy since it can't make insulin on its own. Type 1 diabetes is managed with healthy diet and exercise, regular blood sugar tests, and insulin to keep blood sugar stable. Although type 1 diabetes cannot be prevented at this time, a person with a diabetes diagnosis can be empowered to live a healthy life by participating in a diabetes self-management education and support program.
Far more common, as you noted, is type 2 diabetes, which can be preventable. So let's talk about some of the risk factors for that and the steps that people can take before a diagnosis to reduce their risk.
Absolutely. So risk factors for type 2 diabetes include being over the age of 45, having a family history of diabetes, having had gestational diabetes, or giving birth to a baby who weighed more than 9 pounds, carrying excess body fat, particularly around the abdomen, being physically active less than 3 times a week, having high blood pressure, and having high cholesterol. So while some of these risk factors can't be controlled, such as age and family history, a focus on modifiable factors can reduce risk significantly. So lifestyle modifications can lower the risk of developing type 2 diabetes by almost 60%. These modifications include, number one, losing just 5 to 7% of your weight. As an example, for a person weighing 200 pounds, that's like 10 to 14 pounds. Number two, getting 150 minutes of physical activity a week, and that is just 30 minutes a day, 5 times a week. And finally, number three, working with your doctor to keep blood pressure and cholesterol within normal limits.
You're listening to This is Public Health with the Illinois Department of Public Health. Our focus is on diabetes during this National Diabetes Awareness Month, and we're talking with Keturah Tracy, the Diabetes Program Manager for IDPH. Keturah, you alluded to this earlier, the higher costs that are experienced by people who are dealing with diabetes. Let's talk about that and some of the other challenges that a person may face once they're diagnosed with the illness.
Yeah, so in addition to the increased cost of medical care, just generally receiving a diabetes diagnosis can be overwhelming. In addition to the added healthcare costs, it can be difficult to manage the extra responsibility of monitoring your blood sugar and taking medications. And it can also be alienating if the person with a diagnosis feels they have to eat separate foods from the family's traditional meals. And while individuals with diabetes are encouraged to exercise, triathletes, for example, maybe receiving type 1 diabetes in adulthood, they could have difficulty maintaining appropriate blood sugar levels during extended workouts. But while diabetes can seem daunting, it is manageable and support is out there.
So what role does IDPH play in assisting people with diabetes and in supporting programs for them?
So IDPH is working to increase the number of diabetes support programs, as well as working to increase enrollment in those programs. We also convene a peer network of diabetes educators throughout the state so they can share ideas with each other about how to grow their programs and how to empower those with diabetes.
What are some of the strategies that are being used to reduce diabetes rates, and particularly in communities that are at the most risk? And then how are those efforts targeted to do the most good?
So I mentioned that IDPH is working with diabetes support programs, but we're also working with CDC's National Diabetes Prevention Program, which is aimed at preventing or delaying onset of type 2 diabetes. Like the diabetes support programs, we're working to increase the number of diabetes prevention programs as well as increase enrollment in those programs. As far as targeted efforts, Illinois communities most at risk include Black, Latino, and rural populations because their diabetes rates are higher than the overall crude prevalence in Illinois, and IDPH is engaging local partners that serve these priority populations.
One of the key things that we have seen in recent years in an effort to assist the many people who are dealing with this are efforts to bring some of those costs down, particularly the cost of insulin. Talk to you about that and some of the other laws and interventions that have been put in place in recent years to help those who are dealing with diabetes.
I'm glad you asked that. The state of Illinois has passed several laws to support individuals with diabetes. Regarding insulin, in January of 2020, Illinois became the second state cap out-of-pocket costs for insulin at $100 for a 30-day supply. And as a side note, Colorado was the first, and I did it in 2019, just 1 year earlier. And then later, Illinois, in November of 2023, the Access to Affordable Insulin Act was created, which lowered this out-of-pocket cap from $100 to $35 for a 30-day supply. In August of 2021, Medicaid coverage for both the Diabetes Prevention Program and Diabetes Self-Management Education and Support became available in Illinois, and this allowed programs to be covered by insurance for approximately 1.6 million Illinois Medicaid recipients. Beginning in June of 2022, Illinois insurance companies are now required to cover clinically necessary continuous glucose monitors for individuals with diabetes. So as a side note, many people were excited to see that these continuous glucose monitors, or CGM, are now available over the counter. But for those with a limited income, having insurance coverage for this potential life-saving device is a must.
Truly important initiatives for a condition that has such a big impact on people's lives. And I'm certain there is much more that people would like to learn about this important subject. So where can they go for more information about diabetes, diabetes management, and the programs that are available to help individuals who are dealing with this illness?
The IDPH website has some basic information about diabetes, and it can be found at dph.illinois.gov. That's dph.illinois.gov. CDC, of course, is also a good source of information. If you go to cdc.gov, cdc.gov, and type diabetes in the search feature, DIABETES, you'll find diabetes facts, and you can also search for programs near you for both diabetes prevention and management. Additionally, American Diabetes Association and Breakthrough T1D, who I mentioned earlier, both have many useful resources for individuals living with diabetes on their website.
And always a good idea to talk with your healthcare provider about these important subjects as well, and especially during this National Diabetes Awareness Month. We hope everyone's thinking about this and making those connections. Keturah Tracy is the Diabetes Program Manager for IDPH. Again, thank you so much for joining us here. Be with us next time for another edition of This is Public Health with the Illinois Department of Public Health.